Scott is helping us. Mike, sit up a little bit. Yeah, you see how.
Yeah.
But your camera is my real focus, not the TV. The TV is just giving me the second person I don't have. Okay, but the camera is really where we're really going with this. Okay. Right now, we're here with Dr. Jacob Lindenthal and Mr. Michael Graybow, who are individuals who have been very instrumental in providing an alternative method of educating young people about the medical profession. They are part of the New Jersey Medical School, and Dr. Lindenthal is the founder of the Institute for the Public Understanding of Health and Medicine. And Mr. Graybow is part of his advocacy outreach in order to coordinate and collaborate many of the professionals that are part of this very valuable program. Thank you, gentlemen, for participating with me in this segment. One of the things that has been critically important in our community is the need to take advantage of the wonderful resources of institutionalized training that exist here, particularly in New Jersey. What we have begun to learn in many instances is that the youth in our school systems, especially the urban school systems, are not really participating as much as they should in the medical profession. This program itself, designed by a inspiration, I would think, Dr. Lindenthal, was in effect to approach that type of disparity. What really gave you the interest to find the need?
Well, about 13, 14 years ago, there was some interest in the medical school to create some kind of outreach program like we ultimately created. Of course, what we now have is a far more robust program with many sub-programs, but I happened to notice in the New York Times, actually in 1999, that Mount Sinai Hospital in New York, the Mount Sinai Medical School, I should say, had such a program. So I began to research it, see what they were doing, and then I got strong encouragement, thankfully, from our dean's office and from medical students and professors to move to see just how we could proceed with this. And so I went ahead and I spent a year finding out what's going on in the rest of the country. And I learned there were about 70 programs. So I studied each one and then said, well, what program, how could we take the best of everything that might otherwise be useful to us in Newark? And we created probably, I would have to say, based on what I've been seeing, the most complex such programs nationally, because we are right in the middle of an urban area, and we decided with the dean's office, obviously, and the faculty, that we were going to pitch this to the highest possible standard we could.
Wow.
And we would assume the responsibility of having our medical students and our professors assist our urban students to gain as much as they possibly could out of the program. So much of what we do is assisting students to sort of reach up to this very high level that we have set for ourselves. And it's been remarkable. We have over 6,000 students who have gone through the program successfully, and we have about 600 medical students who have been assisting us since the year 2000.
Wow.
Yeah.
You know, Mr. Graybow, the coordinating effort in relationship of getting individuals who are professionals in the field and who have very involved schedules to participate is pretty much a strong culmination of a lot of effort and a lot of time.
Yes.
What is the process that you put into creating the kind of schedule that exists in this program?
Well, primarily we have faculty from the medical school, from New Jersey Medical School, who participate in providing the teaching for the program. We do have participation from our sister schools, the New Jersey Dental School, the School of Health-Related Professions, the School of Public Health, the School of Nursing. And we're very fortunate to have these very talented faculty participate because they bring to the table their expertise in their respective fields, and it's a win-win situation for them and for us as well, quite frankly.
We're very blessed by a most supportive faculty. Very few have ever turned us down, and those who have had very, we think, if they've offered us their reasons, maybe 4 or 5, have been for very legitimate reasons. I mean, they live far away, or there have been some scheduling conflicts. But the faculty, thankfully, are very much behind this. And of course, it takes quite a bit of preparation on their part. And they don't get paid for it. There's no supplementary monies that go to them for this. They do this gratis because they believe in the community, and they believe in the school.
There must be some significant relationship in terms of ensuring that you're going to get individuals who are interested because of what it curtails. Can you give us an idea exactly what the scheduling exists within, and why it's necessary for someone to know that there is a commitment involved?
A commitment from the student's perspective?
Yes.
Well, we deal with students that are quite motivated. They're very highly motivated. And the students who apply to our program come from all different backgrounds, from all different high schools. And these students are just tremendously motivated to excel. And the guidance counselors who actually recommend these students to us speak in very glowing terms in terms of how these students have excelled academically at their schools. So we start out having a student body that participate and matriculate in our program who are already highly motivated, have excelled tremendously in their studies, and we have an extremely high caliber of student that actually comes into our program. So we basically are very fortunate to have this kind of, these students come into our program because they're just very academically high and very motivated.
So there is an opportunity for urban youth to feel that they can get into the mainstream.
Well, we must say we have limited space. We can only accommodate 250 students, maybe 260, because some drop out in the first couple of weeks. But see, our classroom or our amphitheater will only hold about 250 or 260 individuals, and people got to breathe, and you need some extra room. So that's one of the limiting factors that we have. We'd like to have everybody there, but we consider people as they apply.
Well, it is intense, though, and if there are individuals that are watching this presentation interested, it is important that you recognize that there is a degree of give. There's a lot of work that goes into the medical profession, a lot of hours, and a lot of commitment, and then it's the brain power. You have got to really want to know that this is where you're headed. Now, thinking about that, some of the areas that you will be focusing on in your curriculum deal in a number of different elements of the medical profession. The program starts in October, and it ends
At the end of November.
Okay, and looking at it now, the way you have it structured, is that a particular purpose?
It's a highly intense 8 weeks that
Okay.
the students go through. It's done and constructed in a way to give rigor to the program so that the students get a sense of what being a healthcare practitioner may be like in terms of the education process. So, for example, students who have a desire to go into medicine or dentistry, they actually sit in the same amphitheater, in the same lecture hall that the medical students sit in during the day, and this is obviously given after hours. So, number one, the actual physical location is that which is reserved for medical students. And we also, by the way, have dental school lecture halls too that are very similar to the medical school lecture hall. The intensity of the program in terms of it being 4 hours in duration for any given evening gives that sense of rigor to the high school student who knows that, well, this is a taste of what I am going to be going through if I am to pursue medicine or dentistry or any of the other allied healthcare professions.
Now, I think another component to your question, or the answer thereof, is that when we put together the program, we try to get a balance between the surgical subspecialties, clinical medicine. We try to also give the students some understanding of basic science that is involved in all of medicine. I should also point out that during the first hour, we have what we call a micro-medical course. And that's a course within this course, in which we teach people how to take blood pressures, what blood pressure really means, when is it dangerous, although we always warn our students that they are not physicians when they get out of this program. But this is just for their basic information. We also teach people about medications, what prescriptions are like, the various classes of medications. We teach people what the doctor is looking for when he or she interviews patients. Now that's during the first hour. That's before all these lectures begin. Wow. So that when an individual leaves us, they will have had a substantial amount of information about health and medicine. They should know pretty well what they want to do in life as it relates to health and medicine.
Now, is there any mentoring involved in this program?
Well, the mentoring actually takes place with the 45 medical students. You see, we think it's important that our students meet our medical students. And the medical student says, well, I went to Metuchen High School, or I went to Fort Lee High School, and people identify with that. These are our people, our state residents. This is where people, their parents' state dollars are going. This is what you're supporting, and look at this. We have, I think, about 60 or 70 high schools that are represented in the pre-medical honors program. Well, you know, people say, well, look at this. This is, here's a real live person who's gone through, and he comes in now with a white coat. We all have to wear white coats, you know, the medical students, because we want them, we want the medical students, we want our students to feel free to interact with the medical students and see that it is possible. It is possible to pursue medicine if people, well, they have to have the ability, clearly, but if they have the passion for it. And so that's what we do the first hour. There's a lot of role modeling, and there's also this micro-medical course that we give.
And there's a lot of networking as well, where they are shown around the facility and looking at it. That really gives them a sense of being a part.
Absolutely.
The association within itself is something that's very encouraging, and we have been able to sit down and discuss ways in which We Care Partners will be a supporting involvement with a new type of a program that you're going to institute in the springtime.
Yes.
And that program is going to focus on individuals who are older than high school students.
That's right.
Why is it an important effort to make in relationship to talking to individuals who may not want to be healthcare professionals?
Well, as we all know, all of our listeners know, healthcare is at the top of the list of challenges that the federal and state government has. Medicare, Medicaid, and we believe that by empowering the patient, we can save an awful lot of money and an awful lot of pain and discomfort and problems for individuals. If a layperson knows how to talk to his or her physician, if they know how medications are distributed, if they understand what blood pressures are like, if they understand what the basic problems are that are going to confront all of us as we age, whether it's arthritis or Alzheimer's disease or gastrointestinal diseases, diabetes, et cetera, if they know something about it, if they know how to research the problem, which we teach people in a library course that we give, we think that, as our mantra states, that an educated patient is the doctor's best friend. Mm-hmm. Doctors respond favorably to people who can discuss their problems with them. They like to talk to people. Of course, they give all the care that they possibly can, but doctors themselves need to be motivated and to see that there's some kind of efficacy in their efforts. And people who leave our program, well, our hope is, and we suspect that it's true, are better enabled to carry on that discourse with the medical community. Now, in this particular course coming up, it's not only that we want to stress knowledge about medicine and healthcare and what they personally have to do, but we will be putting emphasis also on how to access healthcare, how to deal with Medicare, how to deal with Medicaid, all the issues of reimbursement, which we think most people just frankly have very little understanding.
Sure.
So we will be discussing that at length in this 8-week course beginning on January 11th. And it's, again, on Wednesday afternoons, late afternoons, and into the evening. Mm-hmm. We really would like to get as many interested people as possible mm-hmm. into the program, and so we're delighted to be here.
Well, it's really important that listeners and our followers recognize the fact that the legitimacy of what we're trying to do is to give an alternative educational method to making sure that people in our community have a rich understanding of what's important about their lifestyles and how they can be able to encourage others to be more involved in finding a knowledge base of real concrete information that is going to help them survive in their lifestyles more fuller and a lot more comfortably. Mm-hmm. One of the things that's really clearly important about this initiative is the fact that there is a tuition involved. And the tuition process is something that has to be dealt with in relationship to referrals and in relationship to you being able to get the information in as quickly in a timely manner. For the pre-medical honors, we're talking about this fall session with the youth. What is the process that a person can get involved?
Well, it's quite simple. Anyone who's interested in coming into the program will go online and register directly for the program. The website that we can provide to anyone who's interested. The person taps into that website and access our homepage for the pre-medical honors program, and then there is a registration tab on the left-hand side. They click on that and up comes the registration page, and small bits of information are asked, like name, address, phone number, email address, high school, principal, guidance counselor's name, things of that sort. And once the registration form is completed online, a copy then goes directly to the guidance counselor of that student, and the guidance counselor then emails back to us whether the student is approved or disapproved to matriculate into the program.
Okay.
Now, a similar process will go on with respect to the mini med school starting on January 11th, except that we will, obviously there's no guidance counselor, anyone who wishes is more than welcome to apply. I think, Michael, we have a website. Do we want to give our listeners the website?
Yes, the website address, the URL address is http://njms.umdnj.edu/the word education, another slash, and the word pre-medical with a hyphen between pre and medical. And that is the URL address for our website.
Well, looking forward, we're going to be involved with UMDNJ, Dr. Lindenthal, and Mr. Graybaugh to help bring more awareness in relationship to these programs that exist. And these are programs that are very important for our community to take advantage of. They exist for the purposes of inviting people from the urban community in particular, but it doesn't limit individuals who are outside of the urban community to be involved. I tell people that I represent a constituency of 50 miles outside of Newark, so that they can understand the dynamics of how important it is to participate in these very important type of opportunities that in many aspects appear as though they're only limited to urban youth. But specifically enough, it is important that the individuals that will apply understand that there is a level of
Commitment.
not only commitment but discipline. I think that's the word that I'm looking for. A level of discipline and respect in regard to this profession that you're getting involved with, but you can be able to be successful with the support that's going to come from especially these two men. I really appreciate you giving me the moment in time that I can share with our constituency and let them know that there are opportunities that they can take advantage of in the healthcare profession, and it's at UMDNJ.
You bet. New Jersey
All right.
Medical School. You bet.
That's right. And we really appreciate you giving us the time, and we'll be looking forward to working with you in the
Our
future.
pleasure.
Thank you very
Thank
much.
you.
Thank you
very much.
Thank you
Thank
very
you.
much. Thank you. There it is. Okay. So this gives me a comfort zone because stop.